Hey there, welcome back. In this video, I'm going to discuss the gastric secretion. Remember that one of the most important component of gastric secretion is also the mechanism of secretion of the hydrochloric acid. I have already made a video on that. Please have a look at that video in order to understand the mechanism of secretion of HCl, because without the mechanism of secretion of HCl, the gastric secretion remains incomplete. So let's come back to this video and let's see what is it that we are going to learn in this video. The objectives for this session are: let's briefly understand the functional anatomy of the stomach, then let's dive into the composition of the gastric secretion, and the most important part is the regulation of the gastric secretion. This is where so many students they get confused. What am I supposed to write? What am I not supposed to write? So stay till the end of this video in order to understand all these three important concepts so that it will be helpful for you in your examinations. So let's start with the functional anatomy of the stomach. Now the stomach is a hollow organ which is situated in between the esophagus. The esophagus is present proximally and the small intestine, that is the duodenum, is present distally. Now this stomach has got two important curvatures. One is called as a lesser curvature and another one is called as this curvature what we are seeing, that is called as a greater curvature. And remember that this lesser curvature shows a kind of angle here, and that angle is what is called as angularis incisura. Few books also mention it as incisura angularis. I think anything is correct. Now next let's try and understand the different parts of the stomach. So this part of the stomach which is going to receive the food from the esophagus is what is called as the cardia, and that end of the stomach is what is called as the cardiac end of the stomach. Now from this cardia, if I am going to draw a straight line which is going to the greater curvature of the stomach, now this part of the stomach which is above this line is what is called as the fundus. And I have already told you that this regarding this angle which is called as angularis incisura, from this angle also if I draw a straight line which is again going to the greater curvature of the stomach, now the part of the stomach which is above this line and which forms the majority of the anatomical part of the stomach is what is called as the body of the stomach, and the part of the stomach which is lying below that line is what is called as the pylorus. Also remember that the stomach is guarded by two sphincters. One is wherein at the junction of the esophagus with that of the cardiac part of the stomach which is called as the lower esophageal sphincter, and there is one more sphincter here at the junction of the stomach and the duodenum which is called as the pyloric sphincter. And we can also see that the inside of the stomach, when we look at, we can see there are these numerous folds. These folds are what are called as rugae. They are called as rugae, and on this rugae we can see these openings, and these openings are the one which are called as pits. It is through these pits that the gastric glands are going to pour out their secretions onto the surface of the stomach. So functional anatomy will remain incomplete if we don't understand the different glands of the stomach. There are three types of glands in the stomach. The first one is called as the main gastric gland, or it is also called as the oxyntic glands. These are the most numerous glands which are present, and these are basically present in the body and the fundus. Then we have the glands which are present in the cardiac part of the stomach. These are called as the cardiac tubular glands. We also have glands in the pylorus, and those are called as the pyloric glands. So let's understand the structure of these main gastric glands, or also called as the oxyntic glands. These main gastric glands or the oxyntic glands are lined by so many different types of cells. The first type of cell which is called as the surface mucus cell, and this surface mucus cell is going to secrete the mucus. It secretes the trefoil peptide and it also secretes the bicarbonate. Next we have the mucus neck cells. This is the stem cell compartment of the mucus cells. The third type of cell is what is called as the parietal cells. Remember that the parietal cells, these are the parietal cells. These parietal cells are also called as oxyntic cells, and these oxyntic cells are extremely important because they secrete HCl, that is the acid, and they also secrete the intrinsic factor of Castle. Remember that this intrinsic factor is extremely important for the absorption of vitamin B12. Next type of cell is what is called as an ECL cell, which you are seeing here. These ECL ka full form is enterochromaffin like cell. This is called as ECL cell, and it secretes histamine. The last is what is called as the chief cell. The chief cell is also called as the peptic cell, and these chief cells are the one which are going to secrete the enzyme pepsinogen. So we have the surface mucous cells, we have the parietal cells, we have the ECL cells which secrete histamine, and then we also have the chief cells. So apart from the main auxiliary glands, as I have already told you, there are two more types of glands. The cardiac tubular gland is there, and then you also have the pyloric glands. As the name suggests, the cardiac tubular glands present in the cardiac part of the stomach, and they are going to secrete the soluble mucus. Then we have the pyloric glands. These are present in the pyloric antrum, and they are going to secrete a thin mucus which is helpful for lubrication. One more important type of cell is present in this pyloric glands, which are called as the G cells, and they secrete an important hormone which is called as gastrin. So this is regarding the functional anatomy of the stomach, in which we have discussed the parts of the stomach grossly, and also regarding the glands which are important for us. Next, let's dive into the composition of the gastric juice. Around 1200 to 200 ml of gastric juice is produced per day, and the pH of this gastric juice is highly acidic, ranging from 0.9 to 1.2. Few books also mention 0.8. You can write either 0.8 to 1.2 or 0.9 to 1.2. The specific gravity ranges from 1.002 to 1.004. Now this gastric juice has 99.5% of water and only 0.5% of solids, and the solids are further divided into organic substances and the inorganic substances. Among the inorganic substances, the most important which you have to write and remember is the hydrochloric acid. Apart from that, everything else is easy. We have all the ions, the sodium, calcium, potassium, bicarbonate, chloride, phosphate and sulfate. Now these organic substances can be again divided into enzymes and other organic substances, and in the enzymes the most important one is pepsin, which is produced as pepsinogen. You can write it as pepsinogen and also pepsin. Other enzymes are lipase, gelatinase and urease. Other organic substance is of course mucus, which is produced by the mucus secreting cell, and again very important, don't forget, that is the intrinsic factor. Okay, this is regarding the composition of the gastric juice. Next, coming to the most important part of this topic, that is the regulation. In the regulation, there are two types of regulation. One is called as a neural regulation mediated by the vagus nerve. Another one is called as the chemical regulation, or it is also called as hormonal regulation. And the most important hormone which helps in regulation of the gastric juice is gastrin. So neural regulation, there is vagus. Vagus is said to be secretomotor. So whenever I am going to stimulate the vagus nerve, there is going to be an increase in the gastric juice secretion. That is, there is going to be an increase in HCl secretion. Also, there is going to be an increase in the pepsinogen secretion. Now, when I stimulate vagus, there are four methods by which the vagus is going to increase the gastric juice secretion. We will understand that with the help of this beautiful diagram. So here we have the vagus nerve. So whenever the vagus nerve is stimulated, vagus nerve is directly innervating the parietal cell via the cholinergic fibers. Hence here the neurotransmitter released in this case is acetylcholine. So it stimulates the parietal cell and it is going to cause an increase in the HCl secretion. Second is, again we have the cholinergic fibers. Acetylcholine is the neurotransmitter here, and these cholinergic fibers, they are going to stimulate the enterochromaffin like cells. Now these enterochromaffin like cells are going to secrete histamine, and this histamine is again going to cause stimulation of the parietal cell, thus increasing the HCl secretion. Third way is that when vagus is stimulated, now vagus is going to cause stimulation of the G cells. We know that the G cells are going to produce a hormone called as gastrin. So when vagus stimulates the G cell increases the secretion of the gastrin, and this gastrin is again going to cause stimulation of the parietal cell. In that way, there is going to be an increase in the HCl secretion. Apart from this, this gastrin can also stimulate the enterochromaffin like cell, which again increases the histamine secretion. Again, there is a parietal cell stimulation and again an increase in the HCl secretion. Now, when I stimulate the vagus, vagus is going to inhibit one cell, and that is what is called as the D cell. And this D cell is tonically secreting a hormone which is called as somatostatin, which is causing inhibition of the parietal cell. So when I stimulate the vagus, this vagus is going to cause inhibition of the D cell. That means the D cell is going to now reduce the secretion of somatostatin, and hence this inhibitory effect which is there on the parietal cell, it is going to decrease. So it's an indirect way of increasing the HCl secretion. And the G cell, when it is stimulated, there is gastrin is produced. This gastrin also stimulates the D cell. It stimulates the D cell. So when there is stimulation of the D cell produces the somatostatin, and the somatostatin is going to in turn inhibit the G cell. So this is a small kind of a negative feedback loop which is present in this diagram. Now this acetylcholine which is produced, it not only stimulates the parietal cells, it also stimulates our peptic cells. Okay, the cholinergic fibers, they also stimulate the peptic cells, and they also stimulate the mucus cells. So when peptic cells are stimulated, there is also an increase in the secretion of pepsinogen, and mucus cells are stimulated, there is also an increase in the secretion of the mucus. One more thing which we have to understand here is that now the acetylcholine is acting on the parietal cell. Okay, this is also important. If you write it, it's good, you will get more marks in your exam. So the acetylcholine which is acting on the parietal cell, these are the cholinergic fibers. The action is via a receptor which is called as an M3 receptor. These are the muscarinic receptors. So this is M3 receptor. And the histamine which is acting on the parietal cell, it is acting via one more receptor which is called as the H2 receptors. Why I am telling you this point is that because we have drugs which are called as H2 inhibitors or H2 antagonists. Okay, these are the drugs which are used to reduce the HCl secretion in the patients who are suffering from hyperacidity. These group of drugs, one prototype I will tell you is what is called as ranitidine, which is usually marketed as Rantac. So these Rantac are nothing but these are the H2 inhibitors. So these are the four ways by which vagus can act. It can directly stimulate the parietal cell, or else it's going to stimulate the ECL cell, and hence ECL is secreting histamine, and which is secreting the parietal cell. It can stimulate the G cells, and the G cells in turn stimulate the parietal cells. Remember that the stimulation of the G cell is not occurring because of the cholinergic fibers, but it is occurring because of secretion of one compound which is called as GRP, that is gastrin releasing peptide. So the fibers which are stimulating the G cells, these are non-cholinergic vagal fibers. So in the vagus we have cholinergic as well as non-cholinergic. The cholinergic are the one which are stimulating the parietal cells as well as the ECL cell. So this is with respect to this is what you are supposed to write if there is for the neural regulation of the gastric juice secretion. Next, let's come to the chemical regulation of the gastric juice secretion. Chemical means nothing but the hormonal, and the most important hormone is the gastrin, and gastrin we all know is produced from the G cells of the stomach. It stimulates the HCl by the parietal cell. It also stimulates the secretion of the histamine from the ECL cell, thus increasing the HCl secretion. I have already explained to you. Apart from increasing the secretion, apart from increasing the gastric juice secretion, it is also increasing the gastric motility as well as the intestinal motility. So what are the factors which affect this gastrin secretion? There could be factors which stimulate the gastrin secretion. There could be also factors which are going to inhibit the gastrin secretion. So the factors which stimulate the gastrin secretion, no prizes for guessing: vagal stimulation, distension of the pyloric antrum, and when products of protein digestion will be present in the stomach. The factors which inhibit the gastric secretion is extremely low pH of the gastric juice. When the pH of the gastric juice becomes less than 2, there is an auto-regulation in order to prevent extreme acidity in the stomach, because when extreme acidity in the stomach is there, it can damage the gastric mucosa. So there is an auto-regulation, a negative feedback mechanism. When extremes of pH, of low pH will be there, now that is going to cause inhibition of the gastrin secretion. And there are some hormones which inhibit gastrin secretion, namely somatostatin, secretin, GIP, vasoactive intestinal peptide, and also glucagon. So this finishes the neural regulation and the chemical regulation, but our job is half done. Our answer is only half. I'm not going to get the full marks if I end my answer here. Why? Because I'm supposed to write also the phases of the gastric juice secretion and their regulation. So there are three phases of gastric juice secretion. First one is called as the cephalic phase, second is called as the gastric phase, and the third one is called as the intestinal phase. So what is the meaning of this cephalic phase? Cephalic phase means gastric juice secretion is going to occur prior to the entry of the food into the stomach. So cephalic phase can be initiated just by thought of the food, smell of the food, sight of the food. When I see the food, there is a gastric juice secretion, and even when food is placed in the mouth, that is by the taste of the food. So this is what is called as the cephalic phase, and the cephalic phase accounts for 30 to 40% of the total gastric juice secretion. And remember that the cephalic phase is purely mediated by neural mechanisms, that is by vagus. There is no involvement of the hormones here. So when I think about the food, when I smell the food, when I see the food, or even when food is present in my mouth or in my oral cavity, what is going to happen? There is going to be activation of the dorsal motor nucleus of the vagus. This is important. So there is activation of the dorsal motor nucleus of the vagus, and when vagus is activated, of course there is an increase in the gastric juice secretion. The contribution is how much? The contribution is 30 to 40%, purely mediated by neural mechanisms, that is by vagus. Now how do I prove that there exists a phase which is called as the cephalic phase, and how do I prove that the cephalic phase is mediated entirely by the nerves or by the vagus? So there is a small experiment which we can do. Now that is called as the sham feeding. So what we do in the sham feeding is we take a dog, we make a hole in the neck, and we bring the esophagus out, and we also cannulate the stomach, and we collect the contents of the stomach in a jar. Now what I am doing is I'll now, with this condition, I'll feed the dog. So whenever I am feeding the dog, what is going to happen to the food content? Whatever the dog is eating, that is going to come out of this neck through the esophagus. So the food is not going to enter into the stomach. Now in spite of that, there will be collection of the gastric juice. So that suggests that there is a phase which is existing, which is called as the cephalic phase. So what was cephalic phase? Cephalic phase was the secretion of the gastric juice is occurring without food entering into the stomach. So food is placed in the mouth or in the oral cavity, there is gastric juice secretion. Now what I do is I repeat the same experiment, but after doing what is called as bilateral vagotomy, that is I cut both the vagi. So when I cut both the vagi and I am doing the same experiment, I will again feed the dog. Now what is going to happen is there is no gastric juice secretion. So this suggests that the cephalic phase is purely mediated by the vagus. It is not under control of the hormones. Okay, so you are supposed to write a little bit regarding this experiment. Next, let's dive into the gastric phase. So gastric phase is a phase of gastric juice secretion wherein the gastric juice secretion is going to occur once the food has entered into the stomach. Now this can occur either because of the distension of the stomach, or it can occur because of the products of the digestion. So this accounts for 60% of the total gastric secretion. 30 to 40% was the cephalic phase, and 60% is the gastric phase. One very important difference between the secretion which is occurring in the gastric phase and the secretion which occurs in the cephalic phase here is that in the gastric phase, the rate of secretion is less, but the duration is more. But in the cephalic phase, the rate of secretion is more, but the duration is less. And remember that the gastric phase is under both the control of vagus as well as hormonal control. So we have both neural mechanisms operating here as well as hormonal mechanisms operating here. So the neural mechanisms are going to get stimulated basically because of the distension of the stomach, and partly maybe also because of the products of the digestion. So under the neural, we have two important mechanisms. One is called as a local myenteric reflex. Another one is called as a vagovagal reflex. This is a central mechanism. So what is this local myenteric reflex is that whenever there is distension of the stomach, what is going to happen? There is stretch of the stomach, and this is going to cause stimulation of the myenteric plexus which are present in the wall of the stomach. So these myenteric plexus are now going to release acetylcholine, cholinergic fibers these will be, and that is going to cause an increase in the secretion. Second, there is one more reflex which is called as a vagovagal reflex. This is the central reflex. So whenever there is distension of the stomach, the afferent nerves, that is the vagal afferent nerves, are going to pass this information to the dorsal motor nucleus of the vagus, and from here the afferent nerves are going to cause stimulation of the gastric juice. That's why it is called as vagovagal. That is, afferent limb is also vagus, efferent limb is also vagus, and this is going to the center. That's why it's a central reflex. And next we also have hormonal mechanisms, and the most important hormone here which is secreted because of the distension of the stomach or because of the products of digestion is gastrin, and gastrin we all know is going to cause a stimulation of the gastric juice secretion. Again, we have to prove that there is a gastric phase, and this gastric phase is mediated both by the nerves as well as by the hormones. So what we do is, there are two pouches which we create. First one is called as the Pavlov's pouch, and the second one is called as a Heidenhaus pouch. So this one is the Pavlov's pouch and this one is the Heidenhaus pouch. What is the difference between these two is that a pouch, this is a pouch which is made out of the stomach, same as that of the stomach, but it is anatomically different, anatomically made separate from the main stomach. So Pavlov's pouch has got an intact blood supply as well as nerve supply. So whenever this animal ingests the food, again there is an increase in the secretion in this pouch, suggesting that there is a phase which is called as a gastric phase, and gastric phase is going to cause increase in the gastric juice secretion. It might occur because of presence of an intact nerve supply as well as blood supply. Why blood supply? Because hormones are entering into the blood. Now we have one more pouch which is called as Heidenhaus pouch. This Heidenhaus pouch is not having nerve supply. There is no nerve supply. Heidenhaus pouch is only having the blood supply. So when food enters into the stomach, even at that point of time, there is an increase in the gastric juice secretion in the Heidenhaus pouch. This suggests that the gastric phase is not only under the control of the neural influences, it is also under the control of the hormones, because hormones are basically secreted into the blood and they are going to cause stimulation of the gastric juice. Okay, so it demonstrates that both neural and hormonal mechanisms are involved in the gastric phase of the secretion. This is what is important. So to prove the cephalic phase, we have sham feeding. To prove the gastric phase, we have this experiment which is called as a Pavlov's pouch and Heidenhaus pouch. Next, let's enter into the last phase of gastric juice secretion, which is called as the intestinal phase. This is going to begin when the chyme is going to enter into the duodenum. Very little amount of secretion occurs during this phase, contributing to 10%, maximum up to 10%, but basically this is a phase where there is going to be inhibition of the gastric secretion, and this inhibition is again under both control of the neural elements as well as the hormonal elements. So what are the mechanisms? The first mechanism is a neural mechanism, which is called as a very important point which you should never forget. This is called as the enterogastric reflex. It is completely neural. So whenever the products of digestion or the food is going to enter into the small intestine, the upper part of the small intestine, there is going to be distension of the small intestine, and this distension of the small intestine is again going to activate the myenteric nerve plexus which is present in the small intestine. Now the myenteric nerve plexus is now going to inhibit the vagus. This is how there is going to be an inhibition of the gastric juice secretion. So what is the stimulus for this? Either it is the acidic chyme which is entering into the small intestine, or it is the distension of the small intestine. Now next, let's understand the hormonal mechanisms. There is one very important hormone which is called as bulbogastrone. This is produced because of the acidic content of the small intestine. So this bulbogastrone is basically going to cause inhibition of the gastric juice secretion. Not only bulbogastrone, there are so many other hormones like cholecystokinin, gastric inhibitory peptide, vasoactive intestinal peptide, somatostatin and secretin. All of them are going to cause inhibition of the gastric secretion. So this finishes our regulation. So let's just summarize as to what all we have understood in this particular video. We started with the functional anatomy. wherein we have seen the divisions of the stomach, and we have also got to know what are the different types of glands which are lining the stomach. Next, we understood the composition of the gastric secretion. We saw how much is the pH, how much is the amount of gastric juice secreted, how much is the specific gravity, and 99.5% is water, 0.5% is solid. Most important are the three important things which you should never forget when you write the composition. Pepsin or pepsinogen is the most important enzyme. Second is intrinsic factor of Castle, and the third one is HCl. Then we understood the regulation of the gastric secretion, wherein we saw that there are two types of regulation: a vagally mediated neural regulation and a hormonally mediated regulation is also there, basically because of the gastrin. We saw what are the four mechanisms by which the vagus is going to cause an increase in the secretion of the HCl, and then we understood regarding the gastrin. And not to forget, we have seen that there are three phases and their regulation: the cephalic phase, the gastric phase, and the intestinal phase. The intestinal phase is basically going to cause an inhibition of the gastric juice secretion. Both the cephalic and the gastric phase, they increase the gastric juice secretion. If this video is helpful for you, please hit the like button, subscribe to my channel, and share this video as much as possible among your friends. Thanks a lot. If you have any suggestions or any comments, do comment in the comment section. Thank you.